Hi, this is Dr. Tom Rogers at Performance Medicine, bringing you the weekly episode of the Common Sense MD. You know, for 17 years now, since I formed Performance Medicine, I've developed a way of delivering health care that I think is important. As a matter of fact, the reason I got into performance medicine after almost 20 years doing it the other way is because I wasn't really satisfied with the way healthcare is delivered, or I was delivering healthcare. The way we're kind of taught to do it, really, I feel is kind of the wrong way. So when I got out on my own and formed Performance Medicine, I wanted there to be a better way. And part of the thing that I want to do is teach you how to do everything from choose the right kind of healthcare insurance to how to interact with your doctor, whether it's with me or any doctor, and get the most out of your health care. One thing that I'm always talking about is preventive care. You know, in traditional medicine, we're always concerned, we're actually taught to prescribe medication, to label a disease, to put it, give you a code for it, and treat that with a medicine. That's just kind of the way we're taught to treat people. And as medicine has become more complex, more crowded, more people are sicker these days, mostly because I think most people are fatter than they used to be and live a more unhealthy lifestyle. But I decided to focus on prevention and finding out the root cause of your illness or your symptoms, whether it be you're hurting or you're tired. You know, it seems like the way the industry's set up is that we want to even find new diseases so we can label them and find a new drug for it. I don't think that's the right way to practice. It certainly benefits a lot of people, like the pharmaceutical industry. It makes insurances more expensive. It's just, we've got a major healthcare crisis in this country, and you know, we need to go to a grassroots level to find the problem with this. That's the reason I went back and did a fellowship in integrative functional medicine, which basically means trying to find the root cause of your problem. And a lot of times it's pretty simple. You're overweight, you live a poor lifestyle, you don't exercise, you don't sleep right, you're too stressed, your body doesn't move right, you don't have the right ergonomics, and things happen as you get older. So, you know, I'm not downing medications. Medications save lives. I use them every day. And there's certainly screening tests that you need to get. There's very important ones. Sometimes I think we over-test and we over-treat people, but there are good tests that you need to get. A couple of them, which I'll go ahead and mention. But and you can, if you get my book on performance medicine, you can scroll through how you need to age. Most of my practice is really focused on, you know, people that are baby boomers that are getting into their 40s and 50s and beyond and starting to need some help in their aging process, because things kind of deteriorate if you let them with aging, if you don't take super care of yourself. You can't do the same things you did when you were 20 years old. You know, I've learned that being 66 years old and seeing multiple thousands of patients through 35 years of practice. You can kind of predict what's going to happen to people. So the screening test, I think at age 45, you need to start getting colonoscopies, and probably just once every 10 years if there's no risk factors. You need to get a CT calcium scan of your heart. And I'm talking male or female. You need to start checking your hormone levels, your vitamin levels. One thing I do in my practice is run a Cleveland Heart Panel, which basically tells me almost everything I need to know about your metabolism, your hormones, your inflammatory markers, and so much more. It's unbelievable. It's a good way to start for me and with my patients. There's other screening tests that certain people need, like a bone density scan. We're talking prostate exams and PSAs, pap smears, mammograms. There's a lot of useful information we have. But approaching healthcare as a patient's a difficult thing to do these days. If you can even get in to see your doctor or provider, that's a monumental task in some cases, because a lot of it's really concerned about insurance and what your copay is going to be, what's your insurance going to cover. That's one reason I got rid of all insurance. I haven't taken an insurance in 17 years I've had this practice, and it made me a better doctor for sure. And it kind of eliminated the red tape, the bureaucracy I had to go through, and I'm just focused on the patient. I try to make it very affordable for the patient. They can file their own insurance. I'm just not going to spend my time talking with an insurance agent over the phone that has no medical training and trying to tell me what to do. I want to do what's right for the patient. So it's a patient-doctor interaction. That's all it is, which in my mind is the most important thing in medical care, is that patient-doctor relationship. And it all starts with your primary care physician. And unfortunately, those are the doctors that have been put under the most stress, and they're the ones that are the most burned out, and the ones that have to do all the red tape. They're kind of like the quarterback that has to put up with everything, kind of to coordinate, team lead everything. So it's a very difficult position to put you in, especially if you're trying to find codes, trying to get insurance, trying to see 40 patients a day or 50 like I used to. It's very difficult to really be effective in finding the root cause of the problem. It's okay if you just want to put somebody on a medicine and get them out your door. But really, if you want to do good medicine, you need to spend more time with the patient and actually listen to the patient. So with insurance, get a high deductible medical savings account so you can determine how you spend your money and not worry too much about what your copay is going to be. Use your dollars wisely and don't throw them away. Invest in your health by using preventive measures and finding out how to prevent illnesses like diabetes, heart disease, cancer. A lot of it's really tied to what you eat and what you put in your mouth and what your gut health is like, how much you move, how much you sleep, how you handle stress. Family history comes into it, but it's only probably 10 to 15% of what's going to happen to you is based on your family history or your genetics. You need to be able to talk to your physician or mid-level. They need to be able to listen to you. And a good tip for when you see your doctor is try to go in there with 1, 2 at the most problems, unless you're there for an annual complete history and physical, or the first time you visit your physician. Kind of make some notes, but when you're there on a routine visit, please limit it to 1, maybe 2 at the most, because if you have a whole litany of problems, I'll guarantee you that physician's going to lose interest and either think you're nuts or hypochondriac or whatever, when you probably are not. I've certainly met a few hypochondriacs in my lifetime, but for the most part, people are genuine and they really want help. And it's just a matter of listening to them and sorting out their problems one by one. And a lot of times it's something real simple that you can do, like a certain habit they have or a certain food that they thought was healthy. Find a doctor or mid-level that really knows about nutrition, because in my mind, nutrition is the most important part of your health. What you put in your mouth determines your health, really. The other things are really secondary. You need to supplement with vitamins. I've changed my mind completely on that over the years. I definitely supplement a lot myself with the right supplements. Vitamin D is paramount over any of them. And then gut health is very, very important. Bowel habits. You need to look at your skin. You need to see how vital you are. If you go around tired all the time and achy or hurting, that means you're not healthy. You need to find out why you're not healthy, why your body's inflamed, and what you can do about it. I use both herbs and I use real medicines. We need both. I kind of think of myself as being a blend between traditional and alternative. And because they're both good, you just don't need to get too far on one end of it. You need to use some common sense with things. things certainly work, and there's certain patterns that you can look at with people that get sick a lot. And it's much more costly to treat a sick patient than it is to prevent it. Now, there's not as much money in prevention for the healthcare industry as there is in treatment. So think about that. Just follow the money with that. So I'm all into a healthy lifestyle, staying lean, teaching you how to sleep, balancing your gut, looking at your hormones, seeing how you exercise. Yeah, you can over-exercise too and keep your body inflamed. I've learned this lesson myself over and over again. I think of myself as being a health nut, but you can certainly overdo it. So it's what your doctor's like. Are they trained in preventive medicine? Are they trying to get you in and out too quickly? Are they really listening to you, to your problems? But there's certain things you can do to help that process. That's by having your main concerns written down, and hopefully one or two problems on a routine visit. Otherwise, there's just not enough time for most doctors to take care of your problem. How you're breathing, patterns of living, your lifestyle. I call it lifestyle medicine in a way, preventative and lifestyle medicine. So, hopefully at Performance Medicine, when you come in here or you even just talk to me on the street, I'll tell you how to approach that patient-doctor interaction and what tests you really need to think about getting to catch early. It's always easier to catch something early than late, not ignoring symptoms of disease. So I know I'm rambling a little bit here today, but these are important things. But I really want to term it healthcare the performance medicine way, which is a preventative approach and a healthy, nourishing lifestyle so that you can lead your best life and hopefully live a long, healthy health span. This is Dr. Rogers from Performance Medicine. I hope this helps you in some way. I'll see you next week.